Well, almost half of all COVID-19 deaths in Canada have occurred in long-term care facilities. Laura Tamblyn Watts is the CEO of CanAge, a national seniors advocacy organization. She joins me from British Columbia today. Ms. Tamblyn Watts, good of you to take the time. Thanks for being with me.
Thank you.
As the Prime Minister and Premiers get set to discuss this crisis in long-term care homes in this country, what do you want to hear from the political leaders?
Well, we want to make sure that they take the swift action that they should have taken about 3 weeks ago. We know that long term care is really struggling to get the staff that they need. The subsidies, which were announced in a very high level just yesterday, are a great step in the right direction. We'd like to know the details of those. And we want to see that people have both the personal protective equipment and they have the testing that we need in order to stop the spread of this as quickly as it has been.
When you say that you want to see these measures that they should have probably been taking 3 weeks ago, a lot of people are saying they should have been taking them 3 years ago and 6 months ago at the very least. There seems to be this sort of I guess portrayal by political leaders that everybody's been caught off guard by this. How do you feel about that?
Look, we've known that the long-term care system in Canada has been broken, and we've known it for years. And certainly the challenges that we have with regards to overcrowding, understaffing, and underfunding have been systemic. As recently as the Wettlaufer inquiry, we had 4,000 pages of a critical review of the long-term care system across this country. So it comes as no surprise, really, to anybody in the field of seniors that this was rapidly moving through long-term care. Our system really needs a complete overhaul.
All right, let's get to that a little bit more on that in a moment. But the leaders now are focused on this idea of boosting the wages of workers in these long-term care facilities, limiting where they can work, the numbers of different facilities they can work at, which many of them do to make ends meet. Is that where the focus needs to be right now?
It's to do in combination with making sure that we get personal protective equipment and testing. Those three things have to go together. So just to give you a sense of how we've been downgrading the skill set in long-term care. It used to be we would have in-house doctors, and most of the care was provided by nurses, and a little bit of the care was provided by licensed practical nurses. Now we hardly have doctors. We may have up to one or possibly two nurses on an entire long-term care home overview, and almost all the care is done by very lowly paid and frankly heroic personal support workers. Sometimes they're getting $15 to $20 an hour, and they have to work 2 and 3 jobs just to make ends meet. We need to keep them safe, and we need to get everyone tested as well.
What's the reason for that transition? You say at one point we had a much more relevant and deeper skill set working at these facilities, and all of that has changed. How did it change?
Slowly having the money taken away from it, it's been slowly let to sit in terms of a political file. It's easy to say, oh, this is the purview of the provinces. This is not our purview for the federal government. And it's easy for the provinces to say that they don't have enough money to deal with it, and that with an aging population, maybe that they have to look at other measures. In the end, nobody has been investing in long-term care in the way that we need to. And our housing in long-term care, so the actual built places, are very, very old in many cases. And so infection control can be almost impossible if you have a room of 2, 3, or even 4 seniors and common bathrooms. We need to make sure that when we're investing, we also invest in new buildings with one person or a couple in a room and one bathroom. Otherwise, infection control really can't be implemented.
We've seen provinces scrambling now to try and deal with this. The province of Quebec, the premier there is effectively begging physicians and anybody who's got a healthcare skill set to come and help on the front lines. In Ontario, the Premier Doug Ford has announced that workers in long-term care facilities will no longer be allowed to work at more than one facility. BC's done the same. Newfoundland, I think, as well. But in Ontario, that order doesn't take effect until a week from now. How concerned are you about that delay when you talk about the need to move quickly?
Now, April 22nd is when they've announced that it will come into force. And I have to say, that is a shocking delay. We needed to have this restriction when those of us in the senior sector were begging for it, more than a month ago. So this other week for the restriction just means lives lost. Nobody is moving around in long term care. The residents are staying put. So the only vector of infection are people who are working in long term care. So this extra period of time just translates into a greater transmission of the illness.
Let's finish on this. We've heard our political leaders say, and health leaders as well, when we are learning lessons from this about how to provide a more thorough, a more dignified level of care for senior citizens in this country. So when this is over, what kind of accountability do you want to see? What questions do you want answered?
I mean, I hope that we move really very quickly into having a conversation about a national long term care strategy. Our population is successfully aging. It used to be that people would go into long term care for a few months and they would pass away. Now, people can live in long term care for decades. So we need to rethink the system. And calls are even being made to think, should it stay with the provinces or should it actually go back to the federal government under the Canada Health Act? These are important discussions that we need to have.
Do you, I mean, in terms of moving forward, that's a way to get to a better place in terms of what we've been through? Some people have suggested we need a public inquiry. Where are you on that?
We've had lots of public inquiries, and I think that people know that the conditions in some cases are ranging from challenging to horrific. I mean, I think answers have already been given. What we need is action and implementation. We need the investment from government now to enrich the lives of older adults across this country.
All right, Laura Tamblyn Watts, great of you to give us your time today. Take care, and thanks for talking.
Thank you.